Sure. Hi. Today we're going to learn how to take blood pressure. The first thing we want to do before we go to take our blood pressure is to get our supplies. So we are going to need our blood pressure cuff. We are going to need a stethoscope. Now generally you will have a regular stethoscope with just one set of earpieces to it. But don't be alarmed if you're doing this skill for state competency. Your evaluator is going to actually get a dual stethoscope. So they will be able to hear what you're hearing at the same time. So when you're doing this skill, we want to go ahead and get our supplies, and we're also going to want an alcohol wipe because we're going to want to clean off our earpieces and the diaphragm of the stethoscope. I'm going to go ahead and get my patient into a comfortable position, so I'll knock. Hopefully I've already met my patient, but Mr. Smith, it's me, Kelly again, and it's time to take your blood pressure. Is that okay? So I'm going to bring the bed up to a good working height. Now as far as privacy curtain goes, I do not have to pull the privacy curtain if I'm not going to need to undress him to be able to take his blood pressure. But if I'm having to take his shirt off to be able to expose his arm, I would pull my privacy curtain then. I do not need to wear gloves for this skill unless it's an isolation patient. So I can do this position with him I can do my blood pressure with him laying down, or if he was sitting up, I could have put the table across him and had him support his arm on the bedside table. You do not want the patient holding their arm up to you, having to use their muscles to do that, because that's going to alter the blood pressure reading. The palm will be up. So what I want to do here is I want to find where I want to put my blood pressure cuff first. So I want my stethoscope to go right over the brachial artery, and I want the artery mark of my blood pressure cuff, where it says artery mark, I want that to go above that spot. So when I find the brachial artery, I like to just bend the arm and then go just a couple fingers in. So here's the bend of my arm, and then I just come in a little bit. I'm on the pinky side of the elbow, and that's usually right in this area is where you're going to find the brachial artery. It is worth trying to find. If you can find that spot and you put your stethoscope right over it, you will be able to hear your blood pressure better. If I can't find it, I won't stress about it. I know that's where I'm going to start with my stethoscope. So I found my mark, I found my brachial artery, and I'm going to hook my blood pressure cuff up. Now the way you know that you have the right size blood pressure cuff is you have an index line here on one end. On the inside of your cuff, you see two index lines. If this goes around the arm and it's closing off before I even get to this one index line, this cuff is too big for the person. I need a smaller cuff. If this index line comes, it's closing off all the way over here, this cuff isn't big enough for them. And if you have a cuff that's too big or too small, it's going to alter your readings. So we will put our artery line mark above our brachial artery. I don't want it directly on it, I want it above it because I want my stethoscope to go right on it. I'm going to put my cuff on nice and snug. Now generally, this is called the Sphygmomanometer. I'm going to try to put this in, I'm going to actually hook it to the cuff, but because of the way his arm is turned, if I'm having a hard time seeing the reading, or for state competency, if you get the skill and both you and your evaluator need to see this, you can set this where both of you can see it. I'm going to hold the bulb in my hand, and I usually like to use my dominant hand, and I hold this between my finger and thumb, and when I turn it to the right, it tightens it, and when I go to the left, it loosens it. So righty tighty, lefty loosey. Okay, and I keep it in my hand the whole time. I'm going to get my stethoscope. I'm going to clean off my earpieces. And you can always make sure that your earpieces look like they're screwed on okay. I'm going to clean off the diaphragm of the stethoscope. Now, generally these are tilted out a little bit more, and they should tilt away from you. So this would not go this way towards me. It's going to be pointed away from me. So this is going to come in my ears. And then what I like to do is I just sort of kind of wiggle it down in my ears, and it'll drop down into my ears a little bit better. And then I'm going to check, I'm going to tap real lightly to make sure I have this turned the right way. This is going to turn it so it will change from the bell of the stethoscope to the diaphragm of the stethoscope. And you want to make sure you have it turned the correct way. I'm going to put this directly over where my artery was, and I'm going to do a nice firm pressure. I don't want to leave gaps between the skin and the diaphragm. Now, with my sphygmomanometer, I am going to pump up till I get to between 160 and 180 millimeters of mercury. So I'm going to pump up quickly, and I did switch from my dominant hand, but I'm kind of used to doing both ways now. And I'm going to let it out at 2 to 4 millimeters of mercury at a time. Now I realize you can't actually see that part of it, but what I'm listening for, when I pump that arrow up to 160 to 180 millimeters of mercury, I'm cutting off all the circulation to that arm. As I start letting the arrow come down, as I'm letting the pressure out, it's coming out at a nice steady clip, like so. You're not looking where does the arrow start bouncing. It's where is the arrow going by? What number is it going by when you start hearing your first sound? And your first sound may be kind of soft. It may be like a bump, 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 and then it'll start getting louder as the blood vessel opens up and blood is starting to come through it better. So it may start off bump, 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 and get louder for you. After the artery opens all the way, you're going to lose the sound, and that is going to be the last sound you hear. You're going to note the number where the arrow was passing when you heard your last sound. Once you're not hearing any sounds anymore, you open it up all the way and let all the rest of the air out, because it's uncomfortable for a person to have this pumped up for a long period of time. Now, if we did this, we pumped up to 160 to 180, and we let it out, and as soon as we started letting it out, we started hearing the bump, bump, bump. We don't know if we caught the first sound, so we would need to recheck it. We would need to actually pump up higher. So I would let the air all the way out, and I would give their arm just a little bit of a break. Usually about 30 to 60 seconds, I'm gonna let that arm relax. And then I'm gonna pump up again, only the next time I pump up, I'm gonna go up all the way to 200. And I'm gonna start letting it out and make sure I caught that first sound. If you get this skill for state competency, you are allowed to recheck yourself or double check yourself. So let's say for state competency, I pumped up my cuff, I let it out, and I thought I heard it around 120 over 70, but I want to double check. You just tell your evaluator, I want to double check. They're going to ask you how long you want to wait, and tell them 30 to 60 seconds. And I can just take it off and move it over to the other arm, but if I heard it, I just want to double check it. It's just as easy to just leave it on the side you're on. So I will double check it in this arm. If I'm still not sure what I'm hearing, then they're going to make you move it over to the other arm. They don't want you to do more than 2 blood pressures in each arm. If I didn't hear anything, like if I did the first one and I heard absolutely nothing, check your earpieces, check and make sure you have your stethoscope correct, move it over to the other arm. The other thing for state competency, so I can pump it up and double check myself, but when I was telling you that if you pump it up to 160 to 180 and you hear it right away and you let it out, you can pump up again to 200. You are not, for state competency, ever allowed to pump it over 200 millimeters of mercury. If you pump over 200 millimeters of mercury, they're allowed to stop your test as a critical fail because endangering the patient. So you are not allowed to go over 200 for state competency ever. So now I heard my reading. I thought I got it at 120. The arrow was going by at 120 when I first started hearing the sound. I lost the sound at 70, so I let the rest of the air come out. Now I'm going to take my blood pressure cuff off. And you would always follow your agency's policies. A lot of them will have you sani wipe it or wipe it down before you take it into the next patient's room. Then I'm going to get my stethoscope, and before I go into I can either clean it now or I can clean it right before I take it into the next room for my next patient. I'm going to make sure my patient's comfortable, that they can reach their call light. Because I raised this bed up, I have to make sure I lower it. And I would wash my hands or hand sanitize at this point. If you're doing this for state competency, you can actually tell your evaluator, I would wash my hands. And then I'm going to record. Now, if I get the skill for state competency, the recording sheet, they're going to hand you a piece of paper that will look like this. It will have your name on it and your ID number on it, and it'll say skill tested. You would mark blood pressure, candidate results. That's you, you're the candidate. So I would mark 120 over 70, and then I would hand the paper to my evaluator. The evaluator is not going to tell you if you were right or wrong. They're just going to take it, write the results, and you're going to continue with your test. And then we're done with our skill.